Hello and welcome back. In today's video, we are diving deep into a condition that silently affects millions of people around the world osteoporosis. This bone disease is often called the silent thief because it gradually weakens bones without obvious symptoms until a fracture occurs. Whether you are at risk, caring for someone who is, or simply want to stay informed, this video will walk you through everything you need to know about osteoporosis, its causes, symptoms, diagnosis, treatment, and most importantly, how you can prevent it. Let's get started. Osteoporosis is a medical condition in which bones becomes weak, brittle, and more likely to break. It literally means porous bones. In a healthy person, bone tissue is constantly being broken down and rebuilt. But in osteoporosis, the rate of bone loss outspaces the formation of new bone. This leads to decreased bone mass and density, making bones fragile and prone to fractures, especially in the hips, spine, and wrist. Osteoporosis is a major public health concern, especially among older adults and postmenopausal women. According to the International Osteoporosis Foundation, over 200 million people worldwide are living with osteoporosis. One in three women over the age of 50 and one in five men will experience osteoporotic fractures in their lifetime. Each year, osteoporosis causes more than 8.9 million fractures. That's roughly one every 3 seconds. So, what causes osteoporosis? The disease is influenced by a mix of uncontrollable and controllable risk factors. Let's break them down. Non modifiable risk factors like age. Risk increases as you get older. Gender. Women are more affected, especially post-menopausal women. Family history. Having a parent or sibling with osteoporosis increases your risk. Ethnicity. White and Asian populations are more commonly affected. Modifiable risk factors. Low calcium and vitamin D intake, sedentary lifestyle, smoking and excessive alcohol use, eating disorders like anorexia, and certain medications like corticosteroids and anti-epileptics. In the early stage, osteoporosis has no symptoms. That's why it's often called a silent disease. But as it progresses, you may notice back pain, often caused by a collapsed vertebra, loss of height over time, a stopped posture or kyphosis, fractures that occur more easily than expected, especially in the hip, wrist, or spine, bone tenderness or fatigue in severe cases. The most serious complications are fractures, particularly hip fractures, which can lead to long term disability and even increase the risk of death. Other complications include chronic pain from spinal fractures, reduced mobility and independence, depression or social isolation due to decreased activity, deformities, especially of the spine. Osteoporosis is diagnosed using a combination of clinical evaluation and specialized tests. Here is how doctors typically confirm it. Bone mineral density test. This is the gold standard. The most common method is DEXA scan or dual energy X-ray absorptiometry. It compares your bone density to that of a healthy young adult. A T score of -1.0 to -2.5 means low bone mass or osteopenia. A T score of -2.5 or lower confirms osteoporosis. Fractures risk assessment tools like FRAX. X-rays may reveal bone thinning or fractures. Blood tests to rule out other causes of bone loss or to check for vitamin D, calcium, and parathyroid hormone levels. Bone health typically progresses through these stages. Number one is the normal, healthy bone density. Osteopenia, mild to moderate decreases in bone mass. Osteoporosis, marked loss of bone mass with high risk of fractures. Severe osteoporosis, same as above but with a history of one or more fractures. Understanding these stages helps in early diagnosis and timely intervention. Now, let's talk about treatment. While osteoporosis cannot be completely cured, it can be effectively managed to reduce the risk of fractures. There are several classes of drugs used, like bisphosphonates, example, alendronate and risedronate, first-line drugs that slow bone loss, selective estrogen receptor modulators, example, raloxifene, mimic estrogen's bone-preserving effects, hormone replacement therapy, used in selected postmenopausal women. Denosumab, a monoclonal antibody that slows bone breakdown. Teriparatide and abloparatide are anabolic drugs that help build new bone. Romosozumab, newer bone forming agent. Calcium and vitamin D supplements, essential to support bone metabolism. Now, let's talk about the lifestyle and home remedies. Weight bearing exercises like walking, dancing, or stair climbing. Strength training to improve bone and muscle strength. Fall prevention. Remove tripping hazards. Use assistive devices if needed. Balanced diet, rich in calcium and vitamin D. Prevention is always better than treatment. Here is how you can protect your bones. Get enough calcium and vitamin D daily, either from food or supplements. Stay physically active. Aim for at least 30 minutes of weight bearing exercise most days. Avoid smoking and limit alcohol intake. Maintain a healthy body weight. Get regular screening, especially for women over 65 and men over 70 years. Review your medications with your doctor if they increase your risk of bone loss. Some individuals need special attention when it comes to osteoporosis. Postmenopausal women due to hormonal changes. Men over 70 years, especially those with chronic illnesses. Patients on long term steroids like prednisone. People with autoimmune diseases such as rheumatoid arthritis or lupus. Those who have had bariatric surgery and may have nutrient absorption issues. Your daily diet plays a vital role in maintaining a strong bones. Foods that promote bone health include dairy products like milk, yogurt, and cheese, leafy greens like kale, spinach, and broccoli, nuts and seeds, especially almonds and chia seeds, fatty fish like salmon and sardines, fortified cereals and juices. Avoid excess salt, caffeine, and soda, too much protein without enough calcium, highly processed foods. A diagnosis of osteoporosis does not mean your life is over. With the right combination of treatment, lifestyle changes, and sport, people with osteoporosis can live full and active lives. Tips include join osteoporosis sport groups, keep a healthy bone friendly diet, exercise safely and regularly, be proactive about fall prevention, and keep up with your doctor visit and bone scans. To wrap things up, osteoporosis is common, especially as we age, but with the early detection, proper medication, good nutrition, and physical activity, you can significantly reduce your risk of fractures and complications. If you or someone you know is at risk, don't wait. Talk to a healthcare provider about getting screened. That's it for today. Thank you for watching. If you found this video helpful, please like it, share, and subscribe to our channel for more expert health information in simple language. Stay healthy, stay informed. I will see you in the next lesson.